Kurumzari. HAKSHEL Plus ngasidi Palliative Care in Manipur Strategies and Challenges have a topic as Thangjari. Maroina Palliative Care Haibasi Karino, Manipurda Kari Khongtang Paikale Amadi, Tongan ba Kudong Chada Kari Lady Bagi Habasiki Matanga, Queen Kangmina Naba. AIIMS New Delhi gi MD Palliative Medicine Aduga Karkinos Karkinos Healthcare Porompat ki Palliative Medicine and Supportive Oncology ki Consultant and in charge Ebiriba Dr. Nandan Choudhary ekoi studio de election biduna lebire. Dr. Nandan Choudhary, you are the first MD Palliative Medicine in Northeast as well as first batch in MD Palliative Medicine of AIIMS New Delhi. Welcome to our health talk, HAKSHEL Plus.
Thank you so much.
Doctor, like in Manipur, as in many parts of India, like families are facing growing challenges in this caring for loved ones. We have like for chronic illness or to end of life illnesses. So this kind of lack in careness is especially witnessed in Manipur. So from doctor, we want to know in this talk what is exactly the meaning of palliative care? And we also know that many people think that palliative care is only focusing on end-of-life care. Is that accurate?
First of all, I would like to thank you for inviting me to this program. And I would like to say that this is one of the very, very important topic. And through this talk, I'm pretty sure that many of my listeners are going to get benefited. And I would like to make this care term palliative very, very simple so that many of the patients who are suffering right now can get some benefit. So coming to the what is palliative care? So if you look at the literal meaning of palliative, so palliate means relieving of suffering. So if you look at the history, long time back, in World War II, there was one lady called Dame Cicely Saunders. She was, she is a UK-based lady. She was initially a social worker. So there was many injured soldiers at that point of time. So whenever they used to get injuries, she used to take care of the soldiers. During the care, she also used to find many people who were having chronic illnesses, and she observed that this group of patients were suffering a lot. They were not only suffering physically, but there were complex or very varieties of dimensions of suffering that was making the patient very the conditions were very bad.
Distressed, emotional.
Yes. So they were the patient was not only suffering physically, but those group of patients, they were suffering emotionally, psychologically, spiritually. So she was the one who realized that okay, there is something else to be done to this patient. They have to be cared in a very very comprehensive way, like a holistic way.
Like not only to address the physical pain.
Yes. So she thought that okay, this group of patient has to be cared in a very separate or very sophisticated way. So then she started keeping them in a separate place somewhere so that they can be cared properly. And then she started studying more about those illnesses, how she can help, what are the medicines that should be given to make them more comfortable, so that they, whatever time is left, maybe 6 months, 1 year, 2 years, whatever time is left, they enjoy the life, they have good quality of life. So she started talking about good quality of life, caring for this kind of patient, and then slowly she started meeting other healthcare professionals. She was not a healthcare professional that time, so she was working under a orthopedician doctor that time. So she told that I want to care for this kind of patient. She told that okay, if you want to care, then why don't you do medicine? Go and do medicine. So before joining medicine, she was a nurse actually. Then she joined medicine just to take care of this kind of patient. She joined medicine and then she started learning about all the medical things. She passed medicine and then she started caring. She opened a hospice. So hospice, I have talked about palliative. Now hospice is a different place actually. It's a separate place, just like a hospital, a separate kind of a building where someone who has life less than 6 months or like that, and who's
like it's a little bit different from a hospital.
Yes, so different from hospital. So she built a first hospice in London. That name is St. Christopher's Hospice, and then she started working full time, and she started taking care of all those patients. So coming to what is the definition, if you look at the definition of palliative care from WHO point of view, so it's a medical specialty which take care of chronic illnesses patient, chronic illness or life-limiting illness, any illness which will limit someone's life. Like the most common, if you look at the illness, is cancer. Someone who hear about cancer, they will think that it's a death sentence. Sometimes, yeah, it's a very scary thing. And so that is one of the example of life-limiting illness or chronic illness, where the illness doesn't last for 1 week; it lasts for maybe months or years sometimes. So this is called chronic illness. Chronic means something that lasts for longer time. And so that is one example. Another example, if you look at, is end stage heart failure. So someone's heart is not working, so their life will be limited now. And the illness is chronic, like end stage liver disease, like cirrhosis. If the cirrhosis is decompensated, like cirrhosis has gone a little bit too far, that patient also, there is no cure. So when there is no cure, their illness will keep increasing, and when the illnesses are increasing, the suffering will increase, the problem will keep increasing. Also, there are like many conditions like COPD, many like Alzheimer's disease, dementia, advanced dementia. Older people, they have complex needs, like someone who is 70 years. They might be not only having physical problem, but there might be many other problems actually that we don't really focus sometimes. So palliative care, addresses all these illnesses. What is unique?
For example, what about this HIV/AIDS?
Yes, HIV/AIDS also is life-limiting illness. So whenever someone is diagnosed with HIV, so far there is no proper cure, but drugs are being developed. But even if someone gets HIV, there are good drugs which can extend their life to a very good extent, as normal as possible. But still, their life will be somehow limited. Okay. And at the same time, there are a lot of side effects of the drugs. There are some problem, like physical problems or psychological problems associated with the disease itself. So that part will be taken care by our team as a palliative care team. There are many other illnesses, like even
doctor, you mentioned about say life-limiting illnesses, chronic illnesses. But what about those who are suffering from paralysis or something like a disabled person? How about that?
Yeah. So anyone having stroke, or let's say like road traffic accident, and they are now bed bound. Now their suffering is a lot. You can't imagine how much they are suffering right now. One is physical suffering, like can you imagine someone who has been enjoying their life, every day active, very active. Now suddenly, because of one accident, they are lying down on the bed. Yes. This physical suffering is there, but can you imagine how? I still remember some of the patient who I visited home. The patient told me that he looked at me and he told me, "Sir, you are having a very good life." And then that clicked me very hard. I felt very bad. Okay, I can't imagine like how much he might be going through. He might be thinking about all those things. Whenever he might be looking at any other normal people, he might be thinking that what I have done wrong in my life, that I am deserving all these things. So, I mean, there is no medicine for that. But at least my job is to at least be with them, at least give them some time. At least hold their hand, at least tell them that I am there. My team is there. I am there to help you. There's no medicine for all this suffering, but at least being with them as a human, giving them human touch, at least will give them some support.
Yeah, in short, to give them support, to care for them, as well as to improve the quality of their life, as long as they stay. Yes. So that's what what palliative care exactly means. So later we will go into depth about the challenges and what are the steps to be taken.
One more thing I wanted to add. So regarding palliative care, why it is unique from other specialty. So when you see any patient, like let's say cancer patient, so when the patient are suffering, they are suffering not only for 7 days or 10 days. It takes months and years of suffering. So that patient is suffering that time. But something I call something as invisible patient, that are caregivers. Just to care for the patient, they have to leave their job. They have to keep coming to hospital for every sample, for every chemotherapies and radiotherapies. So in palliative care, we not only help the patient but also the family members. We talk to them. We try to listen to their worries. We try to address them. We try to help them. So we look in a very holistic way, so that we not only care for the patient but also for the caregivers, and not only the physical, social, psychological, spiritual, whatever is possible. Even if you look at the definition of WHO, WHO definition of health, it tells us that health is a complete well-being of mental, social, and psychological well-being. So that should be our priority, and that's what we are committed to.
Okay. So now we want to know is how is it different from curative and medical treatment?
So yes, there is a big myth actually. What people think is that palliative means now there is the patient are not eligible for any curative treatment. So sometimes like some of the oncologists, they refer to me as now go and meet Dr. Nandan for palliative care. And suddenly the patient, they start Google, they'll start checking online what is palliative care, and then what kind of medicine he's going to give me. So they'll search and they will find that okay, palliative care means end of life. Now the patient is going to die, and they feel that there is no hope now. So, and then what my job is that just to give support to the patient. It doesn't mean that the chemotherapy, I am there to stop the chemotherapy or stop the radiotherapy or stop some other active treatment going on. My job is to make sure that whatever treatment are going on at the same time, to support them. Support them in any way, whatever is required. And my job is to make sure that whatever suffering is there, to relieve all the symptoms, like pain can be there, like nausea, vomiting, constipation, difficulty in breathing, any symptom is there. My job is to make sure that they are not suffering in that way. So that's my part. So that's why sometimes palliative care term itself makes me very. They feel that now I'm not going to give anything to them. But I have seen many patients, or most of my patients, they tell me that I wish that the other doctors would have referred me earlier to you, because I feel now more confident in living my life. I feel more confident. I feel more good quality of life. Like we get more satisfied. That's why there is a very good one journal or article or clinical trial published. I would say many, which has shown that if palliative care is given as early as possible, not only the quality of life improves, but also the the longevity also improves. When the your health and your mental well-being and everything is very good, you tend to live longer. You can fight. You have the capacity, and you become more stronger to fight with the disease, any disease. So my job is to make sure that they are more symptom free, same time more confident. They enjoy their life. Even I tell them that sometime I talk about golden hours, golden period. So let's say someone has 1 month left, and the patient is a little bit physically active. So what I do is I try to know about them, like what is their last wish, or I would say like what is something that is very, very important to them. There might be a lot of pending things. Like suppose someone wants to go somewhere and do visit some temple, maybe go some some place where they want to enjoy. So I make sure that I fulfill all those things in that time, and at the same time not to compromise with the treatment. Treatment will keep going, but I want to utilize that time. Utilize the time to the fullest with the family, everyone together.
Yeah, that's very nice.
Yes.
And it's not exactly, the thing is, it's not exactly curing the patient or something like that, but just to improve the quality of life, and also to address the emotional or what to say, distress or any kind of stress for the patient, faced by the patient. That's what palliative care is giving. So that's very nice to hear from your part also, and doctor, the thing you are right now treating or giving to the patient. And then in India as a whole, now the thing is, in the present days, the awareness of palliative care in India, how can you say that it's gaining its importance in India, or especially in Manipur? How will you compare it with Manipur?
So I would say first about India first. So in India, it was started 3 decades back, and it was started in places like Gujarat, Mumbai, Bangalore, Delhi. There are some people from Kerala, some of the people who are like the pioneers of this palliative care. Mostly started from Kerala and Gujarat. So they started, first their priority was to bring some of the awareness and also to procure and make morphine very, very essential. Morphine is some of the narcotics are very, very essential drug. So they started, training and bring awareness to people of India. And not long time back, but and they started many, certificate courses so that many people get trained in prescribing narcotics. So now why narcotics is important is because the pain, if you look at the patient's pain, you can't imagine. I can't tell you right now, but like how much they suffer. The suffering is a lot, actually. You can't imagine. I have done sometimes, many video calls to the patient, and sometimes when they are in my presence, then I make sure that they are not suffering. Sometimes at their home, they suffer a lot, and so these essential medicines are very important. So just to make essential medicines available in all the places, right now there are many awareness and many training programs being done at many levels right now, and many certificate courses. We have an association, Indian Association of Palliative Care, which mostly focuses on training all the doctors and bringing awareness to many part of the country. And if you look at Manipur, in Manipur, the palliative care awareness or all these things started from Palliative Care Society Imphal, which I am part of a member. And the Palliative Care Society Imphal was first established in 2015 by Sir Jugindra. So he actually, luckily, I would say, he was a friend of Dr. Suresh, who is he's a director of Institute of Palliative Medicine in Kerala. He's one of the pioneers of palliative care in India. So he was a friend, and then they had a conversation about palliative care, and then he thought that okay, I have to develop this in Manipur. So Sir Jugindra, he started forming this society along with Dr. Palin, and then the palliative care services started. And recently in 2017, even the National Health Mission Manipur, they also joined in. So jointly, the Palliative Care Society Imphal along with National Health Mission Manipur, they started bringing awareness, started doing some programs like awareness, training programs. They worked very hard. They are giving, doing home care services. So, and I just to tell you that this 22nd and 23rd of November, we are going to have our 5th international conference.
Okay.
And that is a very big thing actually from a small place. We are doing a big conferences. That also 5th conference. And this conference is mostly to bring awareness about palliative care and to give some training to the medical professionals. And if you look at the training model of palliative care in Manipur, through the Palliative Care Society Imphal and National Health Mission, National Program for Palliative Care from the Manipur Health Services, we have they have trained many doctors and nurses, even the ASHA workers and community health worker also. So if you look at the training has reached to the grassroots level in Manipur. It is one of the, I would say, one of the best model of palliative care in India, I would say. Although Kerala is like a standard model, but just we have, we are trying to bring it more accessible in Manipur. So in Manipur, so far, when I came to Manipur like 4 years back, I was very surprised to see that there are a lot of work already been done. And since I have come here, I have done a lot of awareness and
But
training.
can you consider that all the medical all the medical practitioners out here, or like you mentioned, the ASHA workers, the trainings have already been given. Can you consider that it's already been trained, or they are properly well aware of it?
Yeah, they are well aware. Maybe I won't say everyone, but yeah, most of them, they are well aware. But the training will be a continuous process always. So we have done some basic kind of a training to them, but advanced and more extra training are ongoing process. I think recently also next month we are going to have some training program. Sometimes even training might not be enough. Things. Why I will tell you. See, just to care for someone, reading in the books will not make you a very good carer, right? I mean, people might not agree with me, but just to care for any patient, you have to have that empathy from inside.
That willingness.
Willingness, yes. That willingness, you put that extra effort. I mean, the book can't teach you.
Yeah.
It will come from inside. So I think even if I train many people also, I think that impact will not be very much, you'll not be seeing a lot of impact.
Exactly.
But so that's why I want to find a lot of like-minded kind of person. I think through this talk also, I would like to invite many people who want to really help. There are many patients actually. If you look at the data, 6 out of 1,000 patients requires palliative care at one point of time. There might be at least 6 people right now out of 1,000 that might be suffering. So there are only very few people who are trained. I am the only trained, proper trained doctor. So it's not possible for me to look after many people, right? That's why volunteers training, training of the club members, local CSO members, or whoever is possible. I try to train everyone so that they also go and see all those people. Palliative care is not only my job. I think everyone's job should be
it's a collective effort.
Should be a collaborative effort. Everyone's effort. Everyone should have that empathic nature. Everyone should have that to do something for everyone. Right.
But doctor, you mentioned about awareness. It's already been given to the medical professionals and all.
Yes.
But reaching out this awareness program or any kind of awareness talks or something like workshops to the general public, how will you say that?
Yes. So through this conference, we are inviting many general public also. Like we are trying to outreach. We have already reached out to Manipur University, DM colleges, and many other colleges, just to invite many students, so that they come and see our, and they come and learn what is palliative care. There is no lot of medical things like knowledge required just to care for someone, right? So I'll just tell you an example. So let's say I will train you about. I'll just train you about palliative care. I'll just give you 2 hours of talk to you. And then once you realize that, okay, there's this much of things to be done to your, because there might be someone in your locality or in your family who might be suffering. Not today, maybe tomorrow. There'll be someone they'll be suffering. Someone suffering will be there. At least understanding what is suffering, why, how we can care for them, how we can know where to, reach out for essential medicines so that the sufferings doesn't, last bigger. So that much of information also can be very, very useful. One more example I'll tell you. So let's say there is a cancer patient who is at end stage. Stage 4 cancer with last stage, I would say, having multiple spread. And the patient is a daily wage earner, maybe rickshaw puller or taxi driver, someone. And they might be having very less amount of money. Sometimes, they feel that, okay, doctors are giving some treatment and I will be normal. Sometimes, they don't get realistic kind of information. And even when they get sick, they get, very, they spend a lot of money. And with, if they come to me, what I do is I try to, look out everything, their financial matters. And I try to make goals of care, their care plan, what is more suitable for them, what is going to benefit them with that amount of money. Even sometimes what happens, if they have one land, they will try to sell their land also, and at the end what happens, they will die. The land is also gone, the patient also is gone, and that land would have been helpful for their children. They would have get a very good life. So one meeting with me, I would have planned everything. What can be very, very good for them. Sometimes just to relieve suffering, even 10 rupees medicine also can be good enough. So that is my role actually, just to give public awareness.
That kind of awareness should be given to the general public.
Yes.
And see, for palliative care here, just looking at the overall scenario and even the current scenario in Manipur, what will you say that if the facilities is being available in government facilities or what to say, the private sectors, how are the facilities being provided here?
Yeah, if you look at the government sectors, at RIMS they have I think OPD, there is outpatient unit department is there, where they look at palliative care patients and they provide essential narcotics. And most of the doctors at RIMS, they are trained in palliative care. So they look after palliative care patient at RIMS. I think the Department of Radiation Oncology is there. They are looking after in RIMS. Even in Jennings also there are few doctors who are trained in palliative care. They are looking after palliative care. They don't have separate department, although department are necessary just to make sure that the things go well. And in the private sector, we have palliative care services as such. Providing narcotics like morphines and all is available in most of the hospitals. Even in our hospital, we have narcotics available. Even in American Oncology also there are narcotics available. Even in TREVI also I think they have narcotics available. So regarding essential like medicines availability is there in Manipur. Yes, so the training part we have to keep doing, awareness part we have to keep doing. It's a continuous process. So that part I think is still lacking. There's a lot of job to be done in terms of awareness and training. So that we are looking forward.
Yeah, earlier doctor have mentioned about hospice.
Yes.
Is it available here, or
so far,
any kind of home-based organizations or something, some facilities out here which is providing palliative care?
So hospice can be multiple types. Like it can be home hospice, it can be hospital hospice, it can be a separate building where the patient who has terminal illness, they can be cared. So home hospice or home care services are being done by Palliative Care Society Imphal. That is an NGO which is providing free of cost services to the needy people. And there are other like home care private services also there. I'm not sure about the names, but they are doing. And hospice as such is not there in Manipur right now. So hospice is a very, very important thing, but there are some of the people who are very much motivated to open hospice centers in Manipur. Hopefully in next few years we might have hospice also. And if you look at the data, if you look at the Singapore data, Singapore has more than 20 hospice centers, and they have a population of 30 lakhs. Manipur also has a population of 30 lakhs, but we didn't have any hospice here. But because of good awareness in Singapore, they have 30 hospice, more than 20 hospice centers. And if you look at the data of India, we have only 120 hospice centers in India. And in US, they have more than 8,000 hospice. So we are much lacking behind right now. So there are a lot of jobs to be, things to be done right now in India in terms of bringing awareness about hospice.
But how will you say that the progress it's been what you have seen here, like in early days and now at the present scenario? How will you say whether it's progressing fastly or whether it's very slow, in a slow pace?
I would say, yeah, the rate is. I would say slow only. I would say because there are much. We need more actually people, very like-minded people. We have very motivated people, but everyone is not into palliative care full time. So we need many people who are into palliative care full time, so that their job will be all the time looking after all these patients. So there are many other people who are different specialists, but they are giving some time. So they are already doing extra job to take care of this patient, but we need more doctors who are trained in palliative care, and more maybe department wise, maybe in GIMS or AIIMS department, so that we have a big team and we start doing more works. So that's the current scenario.
Okay, that's for Manipur. And looking as a whole for India as a whole, how will you say, or how will you consider that whether palliative care has reached to to rural areas, or is it only focused to the urban areas for India as a whole?
India as a whole, yes. If you look at the South India is full of palliative care. There are many NGOs and many people who are doing palliative care. So it's like the system is very good there in South India. If you look at the North India, then recently we had a conference in Jammu and Kashmir. There also it has reached. Even in Kashmir also there is a good palliative care services. There are many hospitals. We have trained doctors there. They have started the palliative care services. They have palliative care services there. They have ward there. Just to let you know, even in Manipur also, every district hospital there are palliative care unit. Yeah, so in that way Manipur is very good, far very good than other state. And if you look
at the thing is, units are open, but people are unaware of it.
Yes, they should be. I told you, the most important thing is should come from inside. Even if you train also, they might be prescribing. Some people even if I train also, they might be prescribing some drug. So just managing the physical symptom will not give a holistic care. There is something that you have to do extra. Out of the box. There are many nurses and many doctors who are doing who are really doing something to help the patient, to help the people. I'm not telling people to just do it for namesake. Do it from your heart, because this patient need your full support. So that part maybe it will take some time slowly once we have good awareness, then people will start realizing why this is very important. Because, and also I'll tell you one thing, quality of death. Have you heard about quality of death? Quality of life you might have heard. Quality of death. There's something called quality of death. So people in India, if you look at the recent cancer data, so there were almost, I think, 14 lakhs newly diagnosed cancer.
Okay.
And out of 14 lakhs, 9 lakhs people died. And these 9 lakhs people who are dying, they are dying in a very bad way. And this, some of the people who, they did a study on quality of dying, how they are dying. They're dying in a very good way or bad way. They found that India's ranking is very bad. Okay. Out of 80 countries, their ranking is like almost 70.
Quality of death.
Yeah, quality of death. They are dying in a very bad way. So most of the people who are dying, they might be dying in ICU. Can you imagine how scary is ICU? You'll be stick with lot of tubes, lot of injections, lot of monitors. There's no one to hold your hand. There's no your loved ones are not there. And every time like sound is coming, the monitor sound is coming. It's a very bad way to die, right? Someone who has, suppose someone is 70 years old, they have lived their life, they have enjoyed their life like anything. Now, just when they are dying in a very bad way. So that dignified death is not there. So we talk about quality of death. We talk about death and dying, so that they get a very good death. So what is good death is like, suppose we know that most of the doctors, they know that the patient is going to die. They're not going to make it. So during that time, what we do is we explain the patient that, okay, this is the last time. We should take the patient home, and we should make sure that they don't suffer at home. We provide all the essential medicines, and they should hold hand, with the caregivers. All the family members should be there in the home, and they have that very good moment. Take time to express whatever is there. Say last goodbye. I love you, dad. I love you, mom. Take some pictures. Make that moment. That moment is very precious. That is more important. So that is something very, very important.
There is a definition of quality of death.
Yes.
Okay. And we have one that is quality of life, and that another one is quality of death.
Yes.
Now, giving a contribution to this, palliative care treatment, especially in Manipur, how will you say about NGOs or like any faith-based organizations or something like that, their contribution to palliative care?
Yes. So I think I would say there is one NGO, Palliative Care Society Imphal, which is registered. I think it was started by Dr. Palim. She's a hospital. Sir started, and then Dr. Jugindra and Sir started. Way back in 2015. They started, and the services provided by them is free of cost. So there are one dedicated nurse is there. I'm also part of the team. Dedicated nurse is there, such as Natombi. She's very good. She goes home to home, and she gives services to patient whenever it's required. So today also I had one patient who required home care services. Something was I can't go every houses, so it's not possible. There is a team required. So she and one of the medical social worker is there, Roser is there. He and Sister Sanatumbi, they go together, home and home. They visit the patient, whatever help is required. They go at even odd hours also they go. They are doing a very fantastic job, I would say. And that job also is free of cost. And if their patient is having some pain and all, if they require narcotics or some essential medicines, they also provide that through Shiza hospitals. And also sometimes whenever doctors are required, then either me or Dr. Jukindra or Sir Subodha is there. He's also a gynecologist, but he also sometimes take out time, and he goes even on Sundays or sometimes they take out time. And also we have very big support from the Manipur health services under the leadership of Dr. Prem Chandra and Dr. Tilakeswari. They are the one who are looking after palliative care from the government side. So we have a very good support. Luckily, we have very good support from the government side also. And they also are jointly looking after the patient. Even they have many trained nurses and doctors even in the hilly areas also. Sometimes I get call from many hilly areas, like how to manage patient. The nurses, they are trained. So they go home to home. There are many doctors who are going hill areas, and they're taking care of the patient. And they're doing a very wonderful job actually. It's not in the public, But in this conference,
you mentioned about hill areas. Is it possible there?
Yes, it's possible. Yes, they are going. They are doing the very good job. There are some of the doctor and nurses they are doing, and they will be coming in our conference to showcase their work. Actually, I have invited them. They will be coming to the conference and they will be telling us. And those are actually the nurses and doctor of the state services actually. They are not from the private. Our society, we are mostly is giving services to the Imphal area only, because we are only few people. And from the private part, my hospital is a public-private, Karkinos. So I visit personally. I visit many homes. I have done many home visits free of cost. Many homes. Even
you say your team, or what to say, you personally visit the homes at free of cost. But what about the team?
Yeah,
the team, are they charging, or how is it possible?
Yeah, so there might be some private
funding.
No, we don't have any private fundings. I'm just doing
like in this through this team. So if you are going to provide particular care to our palliative care given to a particular patient, you will be providing say life-saving drugs are there.
Yes.
So that's very expensive, I suppose.
Yeah.
So how is it possible?
Yes. So what I do is I try to justify what kind of drugs to be given to the patient. Most of the essential medicines are there very cheap actually. So essential medicines like morphine, it's very cheap. You can buy it at 50 rupees also, 40 rupees also.
Okay.
So if someone's financial condition is not good, I never prescribe any medicine which are very costly. It should be justified according to the financial condition of the patient. But the medicine part, we don't carry any medicine at that point of time. We don't provide medicine free of cost. But our services are free. We go home visit. I personally have visited, I think maybe 400, 500 home visits I have done. Even my car has scratch visiting home because they are very small gullies. Even at odd hours also I have visited many homes. And I give my phone numbers to every patient. Because if I don't give them my phone numbers, then suffering keep increasing every day, right?
Yes.
It's not going to stay. So I think even if I prescribe one medicine today, that medicine might last only for a few days. After a few days, they will be suffering. I know they will be suffering. So they will be requiring my help. And I can't, let that suffering last for 1 hour, 2 hours also. Because they might take, 1 day to come to hospital sometimes. And they might be suffering at home. Why not give them my number, even if their one call to me makes them happy or makes them better, then I want to give that time to them. So I get a lot of calls, free of calls. I do that free services, teleconsultations, most of my patient, and home visits, whatever time is possible. If I'm very busy, then I'll tell them that I'll come later. From the private part, like I'm doing, then from the NGO side, we have Palliative Care Society Imphal. And other private partners, they might be doing, but I'm not aware.
Is there any collaboration with national the WHO? Any collaboration is there for the funding?
We don't have any funding, but we are collaboration with Institute of Palliative Medicine.
Okay.
It's a WHO collaborating center. So we are working very closely with them. I told you about Dr. Suresh. He's one of the pioneers in India. So he's the one who started all these things here. He's coming time to time, doing all the training. So we work alongside with him, and he has a very good WHO kind of model of training. So we make a program along with him, and we train doctors and nurses. I think next month also we are going to have some training programs. So that support we have from him, like from the WHO point of view.
Okay, since the NGO is also doing very well, and even doctor, you have also visited many places, many homes. Yes. We just want to know what is the response, what are the responses from the public?
Yes, responses are very good. They get good relief. If you look at the relief, then that's what gives me going actually. The relief keeps me going. I just want to see them, not suffering. So I still remember one of the patient who was suffering a lot. That patient was from very far away. Child actually, a small child. The child was from very far away. They didn't have any access to any facilities there. Terminally ill child. The patient was having a lot of pain. I still remember it was 11 o'clock in the night. They called me and whatever medicine I gave was not working.
Okay.
Because actually we don't know which dose is going to help. So we have to keep increasing the dose. So that I was like, on the phone for maybe 30 minutes or 1 hour just to help them, keep guiding them until the patient is very comfortable. So I kept guiding whatever medicine was available. It was not available because they can't even come to my place, to a hospital also. Roads are not good, didn't have any access to nurse also. There's no one to give injection. So I kept telling them, give like this, give this medicine, keep increasing the dose. So after 10 minutes, I keep talking. Okay, is it helping or not? Not helping. Okay, keep increasing. And if you look at, I still remember the whole scenario, and I feel I was feeling very bad. And after 1 hour, I think my patient was comfortable.
Okay.
So that gave me good good relief. So that I think many patients they are getting, and they thank me a lot. Sometimes even after dying also they call me for Shraddha. And it's for palliative care, not only ends at the death, dying. We also look at the bereavement part also. So suffering doesn't end there. So someone who has lost their loved ones, they tend to suffer sometimes. Some group of people, they tend to suffer that time also. So we take care of those people also. So we say that palliative care not only ends at death, but throughout wherever is required, like in bereavement also, grief also, bereaving family also, we go and visit them, and so they are our support.
So comparing to home-based visit, this kind of home service, or is it better for giving the facility at the hospital or something like that, like hospice, or instead of giving home services? How will you say?
Home is always the best, I would say.
Home is the best, but in case of hospice care, or in case of hospital, in giving this facility at a hospital, what will be the availability of transportation for the patient?
So, like now, I'll just give you an example. So, why the need of hospice center are increasing in other part of the country, other part of the world. So, in Japan, you have heard about the life longevity is increasing, right? Might have heard about people living in 90s, 100s.
Yes.
So when people are living in 90s and 100s, they will have some illness, right? In 90s, you will have some multiple problems, like joint problem, heart problem, lungs problem, multiple problems will be there. And in those developed countries, what are happening? Their children are also working. Everyone is working, right? No one is jobless. So just to take care of those, the parents, you have to give a lot of time, right? Constant effort is required. So hospice is or long-term care center are those centers where this group of patient who has chronic illnesses, they are kept there, and they are taken care for a longer time. Because now let's say someone's father is there and they have to go job, right? Just to take care of the father, they have to leave their job. It's not possible. So the hospice centers does that same work. They will keep their parents there. And the services are wonderful, actually.
Okay, that means it depends on the choice of the caregiver or the family members.
Yes.
Okay, whether you take it as home base or in the hospice.
Yes.
Okay, that's a choice of the family. And then, is there any misconception of palliative care?
Yes.
Like you don't believe the team or something like that.
Yeah, there are a lot of myths. I'll just bust all the myths. So first is palliative, like term itself, right? So what people think is that palliative means end of life. So it's not end of life. So palliative care, the other term you use for palliative care is supportive care. Supportive care, palliative care means I'm just giving you support. It doesn't matter whether you are in early stage or last stage. It doesn't matter. I'm just here to give you support, whether you are receiving treatment or not.
That doesn't mean that your life is going to end.
Yes, I'm not here to end your life. I'm just here to support you. Be it any support, I'm just here to support you. I'm just here to manage everything. Anything, whatever is bothering you. So whenever I go for rounds or I see many patients, I'll just ask them, what is something that is bothering you? I'm here to manage everything that is bothering you. It might be anything. It might be ceiling fan sound. It might be just light. I'll fix anything. Whatever is bothering you, I'm there to help you with everything. So that is my job. So the medical oncologist, their job is to give chemotherapy. Radiation oncologist, their job is to do radiotherapy. Surgeon's job is to do surgery. My job is to manage everything. Like all the symptoms, all the suffering. My job is to manage everything. So it doesn't mean that if you are being referred for palliative care, it doesn't mean that now you are given up. You are not given up, but you are sent to someone who is going to give you everything now.
Okay.
I am there to give you everything. So that's palliative care actually. That's a wonderful thing, services to be given, and it should be available to everyone. And it doesn't mean that only it's my job actually. Everyone's job. It is job of you also. Everyone's job to give palliative care, just to give support, right? Like someone who is suffering, just go and hug them. Just do anything possible. That is supportive care or palliative care. That's
so what is the training to be provided to the caregiver or to the family members?
Yes, so we have a training program for volunteers, training program. It's a WHO training program. It's a 16-hour training program which is run by our Palliative Care Society Imphal. So someone who are very interested in learning all these skills, it's a very simple skills we can teach in 16 hours. We have a workbook also, we have booklet and everything, and we can teach them how to take care of all these patients who are suffering. So they don't have to be a doctor just to care for anyone, right? So they just have to receive some informal kind of training, or like I would say like some formal kind of training that will make them part of the palliative care team.
Okay, the team, it's not only going to provide to address the physical pain or physical distress, but it's going to address or give you the quality of life, or also and also the quality of that. That is the very the inner meaning of our real talk today. So doctor, the one last thing we want to know is regarding this palliative care, since you said that Manipur is starting to get aware of it, but the knowledge is still lacking. So how will you say, or how will you suggest to the government or to the private sector or to the medical practitioners, how will you suggest to make it, to promote the palliative team or to promote the palliative care here in Manipur? How will you say that?
Yes. So I think this is very important right now. If you look at the cost part, when someone is, I would say, suffering, sometimes I feel very helpless sometimes, when they come to me, like at the end stage, they are already exhausted with all the financial things. They have spent a lot of money in chemotherapy, radiotherapy, surgery, and then when nothing is working, they are, they come to me. And at that point of time, even I'm prescribing some simple medicine also, like 100 rupees medicine also, I feel very sad because they tell me that I don't have any money right now. So I feel very helpless that time. So I would request the government, at least our Manipur government, to include someone who is in who is suffering with chronic illnesses, package for this kind of patient, special package so that they don't suffer. Or I would say palliative care package that will include not only the hospital care but also the home care, because even at home medicines are prescribed. Sometimes even when I tell them to give oxygen, they can't afford oxygen, and I feel very sad. I feel very helpless. I try to contact some NGOs, someone, so that they can get oxygen. But if that is being done by the government, then it will be very good. That is one thing. Second thing would be developing a proper department in RIMS and JANIMS. Very small department, I would say, someone who can be there for full time, looking after all the suffering in the whole hospital. At least identify who are the patients who are suffering, and give them a very good care. That is another. And from the training part, the government should encourage all the doctors and nurses to compulsorily have a internship. There is an internship program after the MBBS.
Yes.
So this should be compulsorily made training in like 1 week training in the internship. That should be there. 1 week training internship in palliative care, and also even in the medical curriculum also, MBBS curriculum, nursing curriculum. This should be made very, very compulsory
for the medical students.
Yes, it should be made compulsory, because I think without this it's incomplete, I would say. And from the state health society, I think they are already doing a lot of things, a lot of work already being done. Yeah, this much I would say.
Okay, thank you very much, doctor, for your valuable insights. I hope those who are watching our show today will get to know more about palliative care and take up this palliative care and even the healthcare providers or even the healthcare sectors, the medical sectors, they will come to know more about this, let the people understand more about this, and then let's see what happens
I hope.
in our society. And taking out this palliative care, I think that is a very important thing at this hour. Thank you very much, Doctor.
Thank you.
Ngasigidamakta di matang asida loisinjari, meeting tabir punampo ang kana krumjali.